So today actually we are. Walaikum salam. Walaikum salam. I'm good. I hope you all are good too and having a great time in your second year. To some extent, as compared to the first year, it has been a very tough time for you. So today we'll continue our journey towards development of head and neck, and we studied about the pharyngeal arches, if you remember. Okay, so today we will continue towards the derivatives of pharyngeal arches, and then, if time allows, then pharyngeal clefts and pharyngeal pouches. One important thing which you all must remember is that the pharyngeal arches, as far as head and neck development is concerned, it is the part which is getting developed from different layers. And what these layers are, embryonic layers are, ectoderm will obviously form the skin, while the musculoskeletal system, which gives rise to the muscular component as well as the skeleton, like if you say a skeleton of head and neck, maxilla, mandible, and then these flat bones, they have a big contribution from neural crest cells. Okay, the actually head and neck musculature has a very little contribution from the somites. These are actually the neural crest cells which come into play and then they take part. And if you remember that the neural crest cells, they are also responsible for, they have some, contribution in the development of cardiovascular system as well, especially in the development of, जैसे आपको याद होगा, the conotruncal region, when there is separation of the conus cordis during development of the cardiovascular system. So who is this? Vakas, is this Muhammad Nihal या क्या नाम है इसका? Okay, so kindly note this name, please.
Okay, ma'am. Okay.
The development of cardiovascular system involves the neural crest cells as well. That is, especially when the aorta, that is a common region, conus cordis divides into aorta and pulmonary artery. That area is involved or requires the involvement of neural crest cells. So whenever there is any defect in the development of head and neck region, it is associated with some cardiac abnormalities as well. So whenever child is born with cleft lip and palate or with some abnormal ears, we also look for the cardiovascular abnormalities. We also look for some congenital heart defect, because these structures, they all involve the development of the proper development of neural crest cells. And let me tell you that these neural crest cells are very delicate cells. They are easily affected by alcohol. They can be damaged by alcohol, and then they can be damaged by retinoic acid as well. This retinoic acid, alcohol, obviously, if a mother, a pregnant woman is taking alcohol, then there is abnormalities in the head and neck region, plus there is abnormalities in the development of the cardiovascular region. So this is why always the head and neck region abnormalities are associated with some other abnormalities in the body, especially cardiovascular system. So we have gone through these slides now. Today we'll be just discussing about the derivatives of pharyngeal arches. The questions being asked in the examination are about the derivatives, like what are the derivatives of first pharyngeal arch, what muscle is derived from the first pharyngeal arch, what is the nerve of pharyngeal arch. So at the beginning or at the middle of the 4th week, the embryo is almost a folded structure. When the folding of the embryo has been done or has occurred, then the next state is the formation of the swelling on either side of the head region or on either side of the buccopharyngeal region. Now these swellings, they are responsible for the formation of face, they are responsible for the formation of neck region, plus the structures which are present inside. Now how they appear? First, there is appearance of the first pharyngeal arch, then that is in the 4th week, then second pharyngeal arch, and part of third pharyngeal arch also appears during the 4th week. Then at the beginning of the 5th week, there is appearance of the 4th, 5th, and 6th arch. As I told you, the 5th pharyngeal arch it usually disappears or does not develop. So that's why we have 1, 2, 3, 4, and 6th pharyngeal arch. Each pharyngeal arch has its own cartilage and skeletal component, has its own derivatives of muscles, plus it has own nerve supply. So question asked are, what is the nerve of first pharyngeal arch? What is the nerve of second pharyngeal arch? So similarly, which muscles are derived from the second pharyngeal arch, or what skeletal components you can get from the fourth and sixth pharyngeal arch? Got it? So these are the questions which are asked, and they are very commonly asked questions as far as the head and neck development is concerned. So this is just a revision that the pharyngeal arch are total 6 in number. The 5th one is rudimentary. And now what is the structure that comprises this arch? From outside, green, this you can see, this is the ectoderm, okay? And this blue from inside is the lining endoderm of the pharynx, because these arches are developing outside the pharynx, okay? This is the future buccopharyngeal region, and these are the arches which are developing. Now there are another 2 important structures. Whole this structure is arch, but there are 2 important structures in between. One is from outside, one is from inside. From outside, in between 2 arches, there is a depression which is known as cleft or groove. This is first pharyngeal cleft, then second, third, and fourth. Okay. Similarly, there are depressions on the inside as well, on the endodermal side. Now, this endodermal side consists of depression in between first and second arch, that is known as first pharyngeal pouch, then second pharyngeal pouch, then third pharyngeal pouch, and then fourth pharyngeal pouch. Okay, there are some books write that there is fifth pharyngeal pouch as well, but that actually merges with the fourth pharyngeal pouch. So practically we see 4 pharyngeal pouches. Okay, and there are different derivatives from all these pouches. And as far as the clefts are concerned, the clefts or grooves have derivative only from first pharyngeal cleft. Rest of the clefts, they are covered. If you remember, last time I showed you a video in which there was overgrowth of the second pharyngeal arch to cover whole of the neck, and that's why our neck is a little rounded structure, because the second pharyngeal arch grows and then joins the 6th pharyngeal arch to hide the second, third, and fourth clefts. So second, third, and fourth clefts actually hide behind the growth of the second pharyngeal arch. So now what are the derivatives? One by one we'll be discussing the derivatives of first pharyngeal arch. Now 3 things you have to remember or memorize in arches. 1, what skeletal components are derived, means what bones are derived. Number 2, what muscles are derived from the arch. Number 3, what is nerve of that arch. So kindly be attentive that this first pharyngeal arch has 2 components. One is the mandibular process and the other is the maxillary process. Okay, and this maxillary and the mandibular process also help in the formation of face region. So this first pharyngeal arch not only forms the face region, it also forms lots of muscles, plus it also contributes to the development of ossicles in the ear, how you would just see. Okay, so what are the derivatives from the maxillary component of first pharyngeal arch? It is the maxilla bone, and then the squamous part of the temporal bone, okay, and zygomatic bone. These 3 bones, they are derived from the first pharyngeal arch. And there is another part of first pharyngeal arch, that is mandibular process. Actually, at the region of mandibular process, first there is development of a cartilage which is known as Meckel's cartilage. The derivative of first pharyngeal arch cartilage component is the Meckel's cartilage, and over that Meckel's cartilage mandible develops. So you समझ कि Meckel's cartilage provide a framework, and above that framework there is development of the mandible, plus there is development of certain ligaments from the first arch mandibular component, and there is development of incus and malleus. I hope you all know. Can anybody tell me how many ossicles are there in the ear? How many ossicles are 3? Excellent, Anna. Okay, 3 ossicles. Can you name them? Total there are 6, but there are 3 on each side. Can anybody name these ossicles? Stapes. Okay. Yes, very good, Anna. Incus, malleus, and stapes. Okay. Now, incus and malleus, they are derived from first pharyngeal arch. Stapes is derived from second pharyngeal arch. Is that clear? First pharyngeal arch will give rise to incus and malleus, plus it will give rise to mandible, okay, and it will also give rise to sphenomandibular ligament. That is sphenomandibular ligament, which is present between the sphenoid and the sphenoid process and the mandible. Okay, so these are the muscular component. Now, the skeletal components. Now, what are the muscles which are derived? I hope you know that the muscles which are related to the mandible, maxilla, and the squamous part of the temporal bone are muscles of mastication. So, what can you name muscles of mastication? What are the muscles of the masseter? Excellent, Yogita. And lateral and medial pterygoid, very good. And temporal saliva, Aryan, excellent. Okay. Mylohyoid is actually not the muscle of mastication. It is the muscle which forms floor of the mouth. Okay, there are 4 muscles of mastication: temporalis, masseter, and then medial and lateral pterygoid, which are present behind, or they take attachment from the medial and lateral pterygoid plate. Okay, these are 4 muscles of mastication which are derived from which pharyngeal arch? Which pharyngeal arch gives rise to? First, excellent, Amna. And then there are other muscles like tensor tympani, which controls the opening and closing of eustachian tube; tensor palatii, which tenses the palate; and mylohyoid, which forms the floor of the mouth; and anterior valley of digastric, which helps in division of the triangles of the neck. That's a muscle of the neck. Okay, so any of these muscles may come, and the question would be like, which of the following muscle is derived from first pharyngeal arch? Is it clear? थोड़ी सी ये चीजें याद करनी पड़ेगी कि कौन से कंपोनेंट्स हैं जो फर्स्ट आर्च से ड्राइव होते हैं. देयर आर लॉट्स ऑफ कंपोनेंट्स. जब ये आप सारा याद कर लेंगे, सब आर्चेस आप पढ़ लेंगे, तो देन इट विल बी इजियर. ओके, so I just revised that first pharyngeal arch has 2 components, that is maxillary and the mandibular. The maxillary gives rise to maxilla, zygomatic bone, and squamous part of the temporal bone. The mandibular process gives rise to Meckel's cartilage, over which there is development of mandible and the incus and the malleus, plus the sphenomandibular ligament. Okay, and there is another ligament, that is the ligament of malleus. These structures are derived from the first pharyngeal arch. The muscle components which are derived are muscles of mastication, tensor tympani, tensor palatii, mylohyoid, and anterior valley of digastric. Now, which is the nerve of first pharyngeal arch? That is trigeminal nerve. Okay, and which part of the trigeminal? It is the mandibular division of the trigeminal nerve. So that's why just memorize that ye jo bhi muscles hain, they are all supplied by mandibular division of the trigeminal nerve. Jo bhi muscles drive hoti hain first pharyngeal arch se. Yes, beta, there are 2 ligaments. I'll show you in next diagram. Jahan pe sahi se wo nazar nahi aa rahe. One is ligament of malleus, that is known as anterior ligament of malleus, और एक होता है स्फीनोमैंडिबुलर लिगामेंट, जो मैंडिबल से लेके स्फीनोइड बोन तक होता है. ओके, दीज आर नॉट विजिबल इन दिस डायग्राम. मे बी हियर यू कैन सी दिस इज स्पाइन ऑफ स्फीनोइड एंड दिस इज मैंडिबल, स्फीनोमैंडिबुलर लिगामेंट, और ये जो है एंटीरियर लिगामेंट ऑफ मेलियस. ये 2 लिगामेंट्स भी मैंडिबुलर प्रोसेस से ड्राइव होते हैं. मैंडिबल इटसेल्फ इज ड्राइव्ड फ्रॉम द मैंडिबुलर प्रोसेस, while maxilla, zygomatic, and squamous temporal bone are derived from the maxillary process. Okay, so what is the nerve of first pharyngeal arch? No, maxillary does not supply these structures. Okay, maxillary division आके ऊपर फिर teeth और इन structures को supply करेगी, but maxillary division does not supply these muscles. Okay, these muscles are supplied by the nerve of this arch, which is known as mandibular. Okay, mandibular division of the trigeminal nerve. Okay, so these are the components of the first pharyngeal arch. You can see that these are the 2 ear ossicles. तो यूं समझने, ये जो कार्टिलेज कंपोनेंट होता है, तो ये यूं इसी ये ईयर तक इसकी कम्युनिकेशन है. The incus and the malleus, they are derived from the first pharyngeal arch. Then there is this is anterior ligament of malleus. फिर यहाँ पे anterior sphenomandibular ligament होता है, and then this is the mandible. Okay, these structures, they are derived from the first pharyngeal arch. Now coming to the derivatives of second pharyngeal arch as well. So these are the malleus and incus, which are derived from first pharyngeal arch. So this is the anterior ligament of malleus, and this is the sphenomandibular ligament, which is attached to the spine of the sphenoid and the mandible, and this is the mandible or Meckel's cartilage. These all are derived from the first pharyngeal arch. Now, what are the bones which are derived from second pharyngeal arch? Okay, so now we are, you can see this line. This line is derived from second pharyngeal arch. और ड्यूरिंग डेवलपमेंट स्ट्रक्चर भी इसी तरह होता है. ये फर्स्ट फेरेंजियल आर्च यहाँ पे स्वेलिंग होती है, फिर ये सेकंड फेरेंजियल आर्च की स्वेलिंग होती है, थर्ड फेरेंजियल आर्च आपने देखा होगा बहुत स्मॉल थी, इसी तरह फोर्थ एंड देन फिफ्थ तो होती ही नहीं है, सिक्स्थ फेरेंजियल आर्च. ओके, इस तरह ये वो नीचे चली जाएंगी एंड दे विल फॉर्म द स्ट्रक्चर्स इन दी neck. So just look at that what is the structures yeah, bones which are derived from the second pharyngeal arch. This is stapes muscle. We said that there are 3 ossicles. Among them, 2 are derived from first pharyngeal arch. Stapes is derived from the second pharyngeal arch. Similarly, styloid process आपने पढ़ा होगा, ठीक है? styloid process पढ़ा होगा, जिसके नजदीक foramen भी होता है, जिससे facial nerve बाहर आती है. So this is known as the styloid process. Plus styloid process पे बहुत सारी muscles भी attached होती हैं, okay? And then there is the stylohyoid ligament. This is also derived from the second pharyngeal arch. Plus there is the lesser cornu. This is the hyoid bone. आपने देखा होगा यहाँ पे एक small bone होती है within the neck, upper part of the neck. This is known as hyoid bone. इसके 2 main parts होते हैं, बल्कि 3. Center में body होती है, then it has a lesser cornu and greater cornu. So lesser cornu and upper part of body, they are derived from second pharyngeal arch. ठीक है? और फिर third pharyngeal arch gives rise to greater cornu and the lower part of the body. Is it clear? I am telling you the components, skeletal components of different pharyngeal arches. First pharyngeal arch we read in detail because there were more components like maxilla and then zygomatic and then temporal bone. Okay, I am repeating, Anushka, that what are the derivatives of first pharyngeal arch, second pharyngeal arch, third and fourth and sixth pharyngeal arch. I am telling you only in this slide the skeletal derivatives. ठीक है? Muscles में आपको next slides में बता देती हूँ. The first pharyngeal arch. Now please follow. First pharyngeal arch gives rise to incus, malleus, anterior ligament of malleus, the sphenomandibular ligament and mandible. Okay. Plus there is development of the maxilla, zygomatic bone and squamous temporal bone. These are all derived from first pharyngeal arch. तो आप ये कह सकते हैं कि bony components ज्यादा derive किससे होते हैं? First pharyngeal arch से. इसी तरह muscles भी ज्यादा first pharyngeal arch से. But second pharyngeal arch also gives rise to muscles. बाकी third और fourth और sixth pharyngeal arch से बहुत कम derivatives हैं. Coming to the second pharyngeal arch, it gives rise to or it helps in development of stapes, styloid process, stylohyoid ligament and lesser cornu of the hyoid bone and upper part of body. देखें, जो hyoid bone है, it has a central body, then it has a small upper process and then lower process. जो upper process है वो small होता है, उसको कहते हैं lesser cornu, और जो lower process long होता है उसको कहते हैं greater cornu. ठीक है? तो this bone, hyoid bone, आपसे question पूछा जाएगा कि from which pharyngeal arch hyoid bone is derived. So your answer would be hyoid bone is derived from third as well as second as well as third pharyngeal arch, because its upper part is derived from second pharyngeal arch, its lower part is derived from third pharyngeal arch. Okay, so what is the part that is derived from second pharyngeal arch? Upper part of body and lesser cornu. And what is the part that is derived from third pharyngeal arch? It is the greater cornu and lower part of the body of hyoid. Is it clear? Up to 3 pharyngeal arches. Third pharyngeal arch only gives rise to part of the hyoid bone, bus, and there is muscle derivative. Okay. Then there is derivative from the fourth pharyngeal arch and the sixth pharyngeal arch. Both these arches form the cartilages of the larynx. Okay. So the framework of larynx hota hai, that is derived from the fourth and the sixth pharyngeal arch. Okay. There is no bony component, but these are the yes. Okay, I am telling you, Isha, about the Meckel's cartilage. Whenever there is formation of bones in head and neck region, तो आपने पढ़ा होगा कि 2 किस्म की ossifications होती है. एक होती है membranous ossification, दूसरी होती है endochondral ossification. तो ये बाकी जो भी आप बोन्स देख रहे हैं ये डायरेक्ट बोन्स बन जाते हैं, देयर इज नो इन बिटवीन कार्टिलेज। ये जो मैंडिबल है वो कार्टिलेज फ्रेमवर्क के ऊपर बनता है, पहले एक सॉफ्ट सा कार्टिलेज बन जाता है, दैट इज दी मैंडिबुलर कार्टिलेज। वो फिर आहिस्ता आहिस्ता जब गायब होता है तो यहाँ पे फिर ऑस्टियोब्लास्ट्स आ जाते हैं अबव दैट कार्टिलेज टू फॉर्म द मैंडिबल। ओके, so Meckel's cartilage is derived from first pharyngeal arch and it is the basis for future development of the mandible. Is it clear, Isha? This is the Meckel's cartilage which disappears and over that mandible develops. Okay, so we have discussed the components of first pharyngeal arch, then second pharyngeal arch, third pharyngeal arch and fourth till sixth pharyngeal arch, which gives rise to laryngeal skeleton. Okay, now what are the muscles which are derived? I just discussed with you first pharyngeal arch. It gives rise to muscles of mastication. It gives rise to, चले आप मुझे बता दें, what are the derivatives of first pharyngeal arch? What muscles are derived from first pharyngeal arch? We just discussed. Okay, masseter, very good. And temporalis, Maria, very good. Yes, mastication muscles, very good. Temporalis, okay. Tensor tympani, good, Anna. And squamous part of temporal, very good. Digastric, okay. Manish, it is the anterior belly of digastric, okay. Tensor tympani as well as tensor pallati, okay. Tympani and pallati, right? So muscles of mastication, tensor pallati, tensor tympani, mylohyoid, anterior belly of the digastric. These are the muscles, okay. These are the two bellies of the digastric. Anterior belly of the digastric is derived from first pharyngeal arch. Posterior belly is derived from the second pharyngeal arch. Okay, we will just cover. And there is masseter, and then there is temporalis, and then there is medial and lateral pterygoid muscles, mylohyoid muscle, which is present at the floor of the mouth. These are all derived from first pharyngeal arch. The second pharyngeal arch gives rise to one muscle that is present in the internal ear, and that is stapedius, because stapes is developing from second pharyngeal arch. Then it gives rise to muscle which is attached on the styloid process, that is stylohyoid. Okay. Then, as I told you, the posterior belly of digastric is derived from the second pharyngeal arch. Then auricular muscle. Actually, human being has few auricular, anterior, posterior auricular muscles, but they are non-functional. In case of animals, they are very much functional. आपने देखा होगा कि जो elephant or all other animals can move their ears. We cannot move our ears because these muscles are not functional. Similarly, we cannot move our nose much as do the animals. So nasal muscles and auricular muscles, they are not as developed in human beings as in animals. Okay. So, and apart from that, the most important muscles which are derived from the second pharyngeal arch are the muscles of facial expression. The frontalis muscle, this orbicularis oculi, orbicularis oris, buccinator, alachnesi muscles, the zygomaticus major minus muscle, the levi superioris inferioris muscle, all these muscles which make up the muscles of muscles of facial expression, they are derived from second pharyngeal arch. अच्छा, तो आप मुझे बताएं कौन सी मसल्स ड्राइव होती हैं from the second pharyngeal arch? कौन कौन सी मसल्स हैं? ओके, फेशियल मसल्स, वेरी गुड रुआ. स्टाइलोहाइड, एक्सीलेंट अनुष्का. स्टाइलोहाइड, यस. ऑरिकुलर मसल्स, वेरी गुड. and stapedius, yes, good. Posterior belly of digastric, okay, good, great. Okay, so all these muscles which we discussed, they are derived from the second pharyngeal arch. Okay, जो pharyngeal arch derivatives हैं, they are more from the first pharyngeal arch or second pharyngeal arch. Okay, so these are the muscles which are derived from second. Third pharyngeal arch से सिर्फ एक muscle drive होती है, that is stylopharyngeus. Okay, कौन सी muscle है? Stylopharyngeus, which is attached on the styloid process and the pharynx. Okay, this is known as stylopharyngeus. Stylohyoid, which arch was giving rise to stylohyoid? Second pharyngeal arch. Very good. Okay, so these are the muscles which are derived from first, second, and the third. The fourth pharyngeal arch gives rise to cricothyroid muscle. Okay, which is attached to the cricoid cartilage. levator veli palatini, which elevates the palate, and the constrictors of the pharynx. जब हम pharynx पढ़ेंगे तो 3 muscles हम pharynx की पढ़ेंगे, superior, middle and the inferior constrictor. These are derived from the 4th pharyngeal arch. Okay, and plus in addition there are 2 muscles, cricothyroid and the levator veli palatini. Okay, so what muscles are derived from the 4th pharyngeal arch? Yes, 4th pharyngeal arch. Yes, cricothyroid, constrictor of pharynx, levator veli palatini. Very good. Okay, so these are the muscles which are derived from the 4th pharyngeal arch. The 5th pharyngeal arch gives rise to intrinsic muscles of the larynx. Okay, no need to name those muscles. These are just intrinsic muscles which help in the movement of the larynx. So these are known as the intrinsic muscles of the larynx. जो retinoid cartilage, thyroid cartilage, or different जो cartilages हैं larynx के उन पे attach होती है. Now coming to the nerve supply. First pharyngeal arch की nerve supply क्या थी? What was the nerve of first pharyngeal arch? Mandibular. Excellent. Okay, mandibular division of the trigeminal nerve. Very good. Now, can anybody tell me what could be the nerve of second pharyngeal arch? Facial. Excellent, Munir. See, all these are their muscles of facial expression. So the muscles of facial expressions, you know very well that they are supplied by the facial nerve. चले आपको स्टेपीडियस की नर्व सप्लाई ना पता हो, आपको स्टाइलोहाइड की नर्व सप्लाई ना पता हो, और आपको पोस्टीरियर वैली ऑफ डाइजेस्टिक की नर्व सप्लाई नहीं पता हो, लेकिन आपको फेशियल मसल्स तो पता है ना, पता है, आपने पढ़ी है फेशियल मसल्स, और आपने ये भी पढ़ा है कि फेशियल मसल्स आर सप्लाइड बाय facial nerve. Okay, so the nerve of second pharyngeal arch is facial nerve. Is it clear? What is the nerve of second pharyngeal arch? Facial. Okay, good. Now what could be the nerve of third pharyngeal arch? Any guess? Third pharyngeal arch. Glossopharyngeal. Excellent, Farhana. Okay, so third pharyngeal arch is supplied by glossopharyngeal nerve. Okay, that means it supplies the stylopharyngeus muscle and it supplies part of the hyoid bone as well. Okay, so glossopharyngeal is the nerve of third pharyngeal arch. What about fourth and sixth? Fourth and sixth have almost same derivatives supplying the same area. What could be the nerve of fourth and sixth? It is vagus. Yes, very good. Okay, so it is vagus, but there are 2 branches of the vagus nerve. External laryngeal nerve supplies the 4th pharyngeal arch. Recurrent laryngeal nerve supplies the 6th pharyngeal arch. Okay, so आपको पता होगा कि larynx हम बल्कि ज्यादा आपने larynx शायद पढ़ी हो. Yes, in respiratory system आपने पढ़ी होगी. Larynx में आपने सुना होगा नाम. Recurrent laryngeal nerve supplies all the muscles except one muscle, that is the cricothyroid. Okay, so this is the recurrent laryngeal nerve, which is actually supplying the intrinsic muscles of the larynx, the cartilages of the larynx. That's why it is the nerve of 6th pharyngeal arch. External laryngeal nerve supplies 4th pharyngeal arch, and thereby it supplies the constrictors of the pharynx and levator muscle. Okay, and cricothyroid muscle. So these are the okay, Vakas, it is 3:45, isn't it? 2:45, isn't it? Vakas, 5 minutes है ना?
जी मैम 5 minutes.
5 minutes है अभी, ठीक है?
Okay.
2 o'clock we start one.
Okay.
So in general you can say that 4th and 6th pharyngeal arch are supplied by vagus nerve, क्योंकि external laryngeal और recurrent laryngeal दोनों जो हैं branches हैं of vagus nerve. Okay, but someone may specifically ask you which nerves is supplying the 4th pharyngeal arch. You will say external laryngeal nerve, branch of vagus. इसी तरह 6th pharyngeal nerve is supplied by the recurrent laryngeal nerve. ठीक है, अब मैंने आपको बता दिया. Maria, there is no reason that why does it degenerate or why does it not develop. So 5th pharyngeal arch does not develop. Okay, first, second, third, fourth होती है, फिर 5th डेवलप ही नहीं होती कि नीचे से 6th डेवलप हो जाती है. तो 5th यूं समझ लें कि डीजनरेट हो जाती है या डिसअपीयर हो जाती है. सो देयर इज नो 5th pharyngeal arch. That's why there is no derivative of the 5th pharyngeal arch. Similarly, there is no nerve of the 5th pharyngeal arch. Is it clear? Okay, so now this is just a revision. These are the derivatives of the. अच्छा, जिस तरह Meckel's cartilage था फर्स्ट pharyngeal arch का, इसी तरह जिस cartilage पे stapes, styloid process और ये develop होते हैं उसको कहते हैं Richter's cartilage. Okay, Richter's cartilage is the cartilage of second pharyngeal arch. Meckel's cartilage is the cartilage of first pharyngeal arch. Okay, then muscles of scalp and face, like अच्छा platysma भी develop होती है from the second pharyngeal arch. Okay, styloid, stapedius, posterior belly of digastric plus muscles of the facial region, and then the nerve is facial nerve. Okay, then the third pharyngeal arch is supplied by the glossopharyngeal nerve. The fourth pharyngeal arch, आपको यहाँ पे superior laryngeal nerve नजर आ रहा होगा. Actually, external laryngeal nerve divides into superior laryngeal nerve. Okay, so superior laryngeal या external laryngeal nerve, it's same. One is branch of the other, but अगर आप external laryngeal nerve भी कहेंगे तो it's same. Then recurrent laryngeal nerve is supplying the sixth pharyngeal arch. Actually, मैंने आपको बताया अनुषा कि the development of bone is not direct. Actually, there is first framework of cartilage. तो पहले जैसे first pharyngeal arch की जगह यहाँ पे एक cartilage होता है जो replace होता है bone से, तो that is known as Meckel's cartilage, जिसके ऊपर mandible बनता है. इसी तरह यहाँ पे जहाँ से stapedius स्टार्ट होती है, another cartilage appears up to the hyoid bone, फिर वो disappear हो जाता है और उस पे greater lesser cornea of hyoid बनता है, stylohyoid ligament बनता है, styloid process बनता है और stapedius बनती है. वो सब एक लाइन में स्ट्रक्चर्स है. ठीक है, सो दैट वाज एक्चुअली इन स्ट्रक्चर से पहले यहाँ पे एक कार्टिलेज था जो रेक्टर्स कार्टिलेज था. यूं समझ लें ये फ्रेमवर्क प्रोवाइड करता है ताकि यहाँ पे स्टेपीडियस बने, फिर स्टाइलॉइड प्रोसेस बना, फिर लिगामेंट बना, फिर हायोइड बोन बन गई. ओके, सो दीज आर द डेरिवेटिव्स ऑफ द first till sixth pharyngeal arch. Now, what is the fate of the arches? I told you that there is overgrowth of the second pharyngeal arch. When it meets with the sixth pharyngeal arch, there is complete closure of the clefts. Okay, only first cleft remains, but there is disappearance of the rest of the clefts, and which are known as the first cleft remains behind. We will cover in groups, and then rest of the clefts they disappear. Okay, agar by some reason this cleft is left behind, it leads to cervical sinus. I will show you the diagram of that cervical sinus. Few words about the congenital abnormalities. Remember that the congenital abnormalities, as I told you, if there is any problem in the development of neural crest cells, it will ultimately end up in the congenital abnormalities, and these are syndromes. सिंड्रोम्स क्यों है? क्योंकि वहां पे सिर्फ हेड एंड नेक की एब्नॉर्मलिटी नहीं होगी, या तो कार्डियक मैलफॉर्मेशन होगी या कोई इंटेस्टिनल एब्नॉर्मलिटी होगी, तो इट विल बी अ सिंड्रोम. सो और एक स्ट्रक्चर इन्वॉल्व नहीं होगी, मल्टीपल स्ट्रक्चर्स इन्वॉल्व होंगी. तो फर्स्ट आर्च सिंड्रोम किसे कहते हैं? Treacher-Collins syndrome. What is Treacher-Collins syndrome? In this syndrome, there is defective development of the first pharyngeal arch, so that there is maldevelopment of the mandible. The mandible is very small, you can see. Plus there is maldevelopment of the zygomatic bone, maxilla, and there is maldevelopment of external ear as well. When we find all these things together, we call it as Treacher-Collins syndrome. What is Treacher-Collins syndrome? It is the syndrome of first pharyngeal arch. Small lower jaw or mandible, malformed external ear. Okay. There was a movie as well in which there was a boy with this syndrome, and that what I remember is a Small Wonder, perhaps. उसका नाम शायद Small Wonder था. The boy otherwise is very intelligent, but he has facial disfigurement and ear malformed होते हैं, इसी तरह इसकी lower jaw. So what is this syndrome called? The first arch syndrome, Treacher-Collins syndrome. Okay. There is another syndrome which is known as Fairy-Robin syndrome. Okay, in this syndrome there is again development of the first pharyngeal arch, but in this syndrome there are many other symptoms apart from small mandible. ठीक है, इसमें ear involvement less likely होती है, but there are other features. Means there is cleft palate. Okay, there is cleft palate and there are tongue abnormalities. Either it can be ankyloglossia or macroglossia. Macroglossia means when there is very large tongue. Okay, एंड एंकाइलोग्लाइसिया तब होता है जब टंग टाई होता है. आपने हो सकता है सुना हो द टंग इज टाइड or is fixed to the floor of the mouth so that the baby cannot speak very well. Okay, so this is known as the Peri-Robin syndrome. These syndromes happen because of abnormalities in the neural crest development. Then the third syndrome is Digox syndrome. Digox syndrome is actually maldevelopment of third and fourth pharyngeal pouches. This is just typing error. I just write arch. It is actually third and fourth pharyngeal pouch maldevelopment because there is thymic hypoplasia. Thymus, yes, the tongue can be that tongue tie can easily be removed. जो fixing होती है, we can make it mobile. Surgically, Ahmed, we can easily correct it. The ankyloglossia can be corrected. Cleft palate can be corrected. So somehow the baby would look normal. जैसे आपने फर्स्ट आर्च सिंड्रोम देखा ना, मैंडिबुलर एडवांसमेंट भी होती है, जिसका मैंडिबल शॉर्ट हो मैंडिबुलर एडवांसमेंट भी होती है. इसी तरह बोन ग्राफ्ट लग सकता है. There are many plastic surgical procedures which can be done to make the अच्छा ईयर की प्लास्टिक सर्जरी हो सकती है ताकि ईयर नॉर्मल दिखे. So all these things can be done. Surgically can be corrected. Okay, so Digox syndrome में third and fourth pouch की abnormality होती है. We will learn the pouch later on, but it is always associated with some heart abnormality like tetralogy of palate, transposition of great vessels. कोई भी abnormality heart की जरूर होगी जब ये syndrome होगा. And then there is hypertelorism. Hypertelorism कहते हैं कि देखें हमारी आईज जो है बीच में एक नॉर्मल स्पेस है. अगर किसी की आईज बहुत दूर हो तो इसको कहते हैं हाइपरटीलोरिज्म. ठीक है, तो डिजॉर्ज में हाइपरटीलोरिज्म होती है. इंस्टेड ऑफ मीडियल कैंथस यहाँ पे होता है तो यूं लगता है कि आईज बहुत दूर है एक दूसरे से. देयर इज अ बिग गैप इन बिटवीन. ओके, माइक्रो मैंडिबल होगा, स्मॉल मैंडिबल, डिस्प्लास्टिक ईयर हो सकते हैं. सो दीज आर नोन एज डिजॉर्ज सिंड्रोम. ट्रीचर कॉलन में क्या था? फर्स्ट आर्च डेरिवेटिव्स डिफेक्टिव थे, ईयर एब्नॉर्मलिटी थी. पेरी रॉबिन्सन में क्या था? टंग एब्नॉर्मलिटी थी प्लस पैलेट एब्नॉर्मलिटी. डिजॉर्ज में क्या है? देयर इज thymic hypoplasia and cardiac defect. Okay, along with the pharyngeal arch abnormalities there is cardiac and thymic hypoplasia. Are you clear about these three syndromes? These are related with the abnormalities of the particularly first and then the first pharyngeal arch and third and fourth pharyngeal pouch. Okay, thank you so much. Next time we will be covering pharyngeal grooves as well as pharyngeal pouches. Thank you so much, Bakas.